I am Jerry Parker, the Associate Dean for Research at the MU School of Medicine and the co-director of the MU Institute for Clinical and Translational Science. I'm also a clinical professor of physical medicine and rehabilitation. And it's my distinct privilege today to be the leader of this new program that's going to launch here at the University of Missouri and that we're going to celebrate today. And indeed, this program, which is aimed at improving health care and reducing costs, I have been told is funded by the largest grant in the history of the University of Missouri School of Medicine. And I would like to begin by recognizing several leaders who have joined us today. I'm honored to have here on the podium Chancellor Deaton, and our medical school dean, Bob Churchill, and Joanne Burns, my close colleague and Chief Information Officer for MU Healthcare. She's also the Executive Director of the Tiger Institute for Health Innovation, and she's a co-principal investigator on this grant. The other co-principal investigators have also played really critically important roles on this project, and I'd like to ask them to stand to be recognized. They are Carl Kokendorfer, who's the Director of Clinical Informatics for the MU Department of Family and Community Medicine. Thank you so much, Carl. Lori Popejoy, who's the Assistant Professor and the Hartford Foundation Claire M. Fagan Fellow at the MU Sinclair School of Nursing. Thank you, Lori. And Eduardo Simoes, who's Professor and Chair of our Medical School Department of Health Management and Informatics. And other leaders joining us today, I'd like to recognize Mr. Ross, James Ross, who's our Chief Executive Officer of MU Healthcare. And again, another close colleague of mine, Senior Associate Dean for Research in the School of Medicine, Jamal Ibda. And from the Tiger Institute, we've had key leaders who are also here today. Adam Chrisman, a Senior Director of the Tiger Institute, Adam. And also a technology expert, Matt Link, who's the Director of Tiger Institute Innovations. Many others from the Tiger Institute, from the MU Institute for Clinical and Translational Science, and numerous other units across the campus devoted tremendous effort, time, and energy on this application. And although it's not possible to recognize everyone, I certainly would like to convey my deep appreciation for the devoted efforts and diligence that were put forward on this grant. I'd also like to thank our Chamber of Commerce ambassadors for joining us today and for their recognition of the significance of this event for the community. By way of background, we are all aware that our nation faces an enormous healthcare challenge. Although we spend more on healthcare and health-related research than any other nation in the world, our citizens, nevertheless, on average, score relatively low on indices of overall health. As a result, there's a great need for innovation, for creativity, and for novel approaches to the delivery of health care. And as you will learn today, the University of Missouri is particularly well positioned to be a national leader in the development of innovative healthcare solutions. So now, to officially announce how this grant will impact our community, state, and ultimately the nation, I would like to welcome Chancellor Deaton to the podium.
Jerry, thank you very much. And what you have just heard is a wonderful evidence that it definitely takes a community to get the big job done. And I just want to commend everyone who was recognized earlier, the co-PIs on this, as well as certainly the leadership, Jerry and Dean Churchill, Dr. Williamson, my colleague, Vice Chancellor for Health Affairs, who have all supported so much this tremendous innovative work. And it's a testament to the commitment that we have here at the University of Missouri for patient care, education, and research here at the university. And thanks to all of you for coming out today to help us celebrate. And it gives me just great pleasure to be able to recognize this record-setting grant that we have of $13.3 million as federal grant for this innovative work that's going on in the School of Medicine. That deserves a round of applause, I think. You know, there were 3,000 applications that went in for these funds, and only 107 programs selected to receive them. So that gives you some sense of the exalted class that the University of Missouri Healthcare is in. And it's a great project team, as you've just heard Jerry talk about, and your presence here today reflects the respect and pride that we all have in this program of work here at the university. And the $13.3 million is to create a program called LIGHT, or L-I-G-H-T squared, which stands for Leveraging Information Technology to Guide High-Tech, High-Touch Care. And this innovative program will serve nearly 10,000 Medicare and Medicaid beneficiaries who receive primary care at MU. Now, this is, to me, is the important bottom line, that it will serve Medicare and Medicaid beneficiaries, 10,000 here being served at MU. And that support will be in the form of disease self-management, improved delivery system design, a focus on preventive care and better decision-making tools. Light Square is also expected to save $17 million in healthcare costs over the next 3 years. That's savings of $17 million. And the program will train an estimated 420 workers and create approximately 30 jobs, which gives our community even more reason to celebrate. And the Chamber ambassadors here today, you help us by showing the critical integrated nature of what we do at the university with the broader community here in Columbia and Boone County in central Missouri. So this is a wonderful illustration of how powerful these funds are, how critical they're going to be for reducing some of these cost issues and health issues that Jerry talked about just a moment ago. The Light Squared program will combine advanced technology with education for our patients and providers, and ultimately this effort will enable MU to truly be a model for our nation. And we have people here today that you're going to hear from in just a moment who can give you much more detail and in-depth perspectives on the vital nature of this program for the university and for our society at large. And again, I want to commend and congratulate all those who put so much effort into this. It's truly a wonderful step forward with the largest grant ever received by the University of Missouri healthcare system. I'd like to invite Dean Bob Churchill to the podium, who will continue this discussion. Dean.
Thank you, Brady. It's a real honor for me to join all of you today in the celebration of receiving this grant. As I look out over the audience, I don't see another Hawaiian shirt in the building, and I'm wondering why, since it's so hot out. You know, I really like to take some credit for this grant, but I really can't. Several weeks ago, Jerry Parker came into my office and briefly explained what this grant was about, and he said, "Do you think we should go for it? It's going to be an awful lot of work for me." I said, "Yeah, I think we should try." And for the next several weeks, he had a sleeping bag in his office and pretty much never went home until this thing was finished. And then Deb Taylor was busy copying all kinds of things that sent the grant in. I'd like just to take this opportunity to explain in part why only 4% of applicants who received this funding for this federal award, and we were one of 4%, and there's some reasons for that. And they're the same reasons why we've had many successful grants in the past few years at the School of Medicine. And we are fortunate to have research-intensive schools like the School of Medicine and the School of Health Professions and the School of Nursing who partner with our hospital system to form a comprehensive academic medical center. Few other universities have this resource on a single campus. At MU, we use this advantage to bring together the best in education, research, and patient care. Second, MU is fortunate to have strong partners both in our community and across the state. We received this $13.3 million grant in part due to our collaboration with Cerner Corporation. This public-private partnership has positioned MU to become a world leader in using technology to make healthcare better, more effective, and more efficient. In other words, MU is setting a new standard for delivering care that makes patients healthier and happier and at a lower cost. And finally, it takes a commitment to quality improvement to make patients increasingly healthier and more satisfied. As many of you know, our medical school, if not the first, is one of the first in the nation to adopt the Baldrige criteria for performance excellence to a school of medicine. This commitment to strategic teamwork and results has allowed our medical school to get better and better year after year in targeted areas of education, research, and patient care. We're also happy that this success will improve our local economy by creating quality jobs and educational opportunities for our community. I want to end by adding my congratulations again to Dr. Jerry Parker and the team that he worked with, the other PIs, to put this grant together and make it successful. And we are really becoming a leader in promoting our nation's health, particularly in the area of Medicare and Medicaid. To explain the high-tech component of this new program, I'd like to invite one of the team's leaders, Joanne Burns, to the podium.
Thank you. It's a pleasure to be here. And just hearing Bob's discussion with Jerry and what ensued back last fall, late fall, early December, I think he had a number of interesting discussions similar to that around that. And I think it was back in around October, I met with Jerry and asked him to partner with us in the Tiger Institute and really head up the research arm of the Tiger Institute for us. We had an opportunity with turnover in some staff. And I said, you know, we're easing into this research thing. We're kind of figuring it out a little bit, but it's an area that we really need to focus on. And it was shortly thereafter that CMS announced these grant opportunities, and I remember him coming to saying, do you think we should go for it? And I'm like, sure, let's go for it. He's like, it's a really tight timeline, Joy. And I'm like, yeah, okay, we're in, we're all in. And I think he didn't come out of his office, as Bob said, for about 2 months. So really, Jerry did a great job, and his leadership was really the glue that held us all together. The other piece is Dr. Hal Williamson as the Vice Chancellor for the health system, who was here earlier. I don't know if he's still in the room, but he's another one who we talked to about, and it really was the opportunity to bring the whole health system together to work on this. So we had School of Nursing, School of Medicine, School of Health Professions involved, as well as the hospital and clinics and healthcare provision. So all of that coming together, I think, was a great testament and really what we're all trying to accomplish and do. A minute about the Tiger Institute. Back in 2009, as Bob said, we were looking at Cerner wanted to do something more, and MU wanted to do something more. And we felt like together we could do something a lot better together than we could do individually and move each other forward. And I think this grant is really one of those things that has shown that. I don't believe that Cerner could have achieved this without the partnership with MU, and MU in partnership with Cerner doing it. So it really feels like this is what we have been working towards and designed to do over the last 2.5 years. The goal of the Tiger Institute is really to improve the health and care of Missourians. We've got 3 sort of guiding principles, if you will, around innovating around healthcare, connecting Missouri, and empowering wellness. And this grant really embodies that vision and those goals of the organization. So it's pretty exciting to see. On the high-tech side and what we're doing to improve care and really moving things forward, we're probably taking a number of different steps. So one is around the physician workflow and how the physician actually cares for patients. We're enabling dashboards which you can look at from a patient level. So as a physician is engaging with their patient at the point of care, they can see how is this patient doing really for themselves, how are they embracing their care, and how are we proactively managing. So trying to move from a reactive kind of mode of interaction in healthcare to a proactive, and shifting our costs to wellness and care and maintaining wellness from a let's just treat them when they're sick or they've got some chronic illness that's had a flare-up. Those are going to happen, but we should be able to prevent more of those through these dashboards. The other things that the physicians will be doing is looking at these dashboards at a population. So how are all of my patients who I'm taking care of with diabetes comparing to each other? What do I need to do better? And also, how am I comparing across the whole population? Do I need to be learning from my colleagues how to do better and be more proactive? So it's pretty exciting to think about enabling that. And really the data that's there is what really pulls together and starts making that change in healthcare from what we've been doing to what we need to do. The other thing that's really exciting about this, that I was most excited on one front, was around the patient engagement. So it's about enabling patients to start really looking at taking care of themselves and proactively engaging and partnering in their care. So they don't have to wait for the physician to call them up or somebody to remind them you need an appointment. They can actually engage. So there's a patient dashboard that we're enabling that they can use online, take a look at home, see where I'm at, how am I doing, upload my scores, whether it be my blood glucose, my weight, my blood pressure, whatever I may be doing. It starts to enable me to be much more proactive and to work with my physician and my healthcare coach in a way that can really change the game for them. This will be able to be deployed across any electronic medical record, so it won't be specific to any one vendor solution or what might be in there. So there's a way to really engage across all of the United States, and that really is the goal of what we're trying to do. So I think broadly, it's pretty exciting to see. I think it embodies the really the goals of what we're all trying to do together. So with that, I will turn this over, I think, back to Jerry for some discussion about the high-touch components.
Yeah. Thank you, Joanne. And again, beyond the high-tech parts of this grant, there's also the high-touch components and training components. And the high-touch involves training a new workforce comprised primarily of healthcare coordinators, specially trained, and a new category of worker called health information analysts. And the health information analysts in particular are a rather innovative new type of care worker. And they will focus on a specific panel of patients that they're assigned to. And healthcare analysts will be trained to use the light-squared technology to mine data that can improve the health of their assigned subpopulation of patients. And these analysts, through the use of the technology, the high-tech components that will support them, will be able to gain access to valuable, actionable information that's contained in the electronic health record that can be used to more effectively manage a population of patients. Now, while the health information analysts are working behind the scenes mining data, the healthcare coordinators will directly help patients become more engaged in their own health. These coordinators will provide support for a healthy lifestyle. They'll educate patients regarding the management of chronic disease, and they will serve as a point of contact for providing more coordinated, efficient care. The coordinators will also help patients form strong relationships with their primary care teams and improve effective interactions. So if care coordination and the delivery of preventive health services can be improved, we hope to reduce emergency room visits, prevent unnecessary procedures, and avoid unnecessary hospitalizations. And these outcomes should translate into healthier patients and reduce costs. And these are indeed the ultimate goals of the project. Now, to help us officially launch the Light Squared project, I'd like to invite our Chamber of Commerce ambassadors to lead us in a symbolic ribbon-cutting ceremony, which we greatly appreciate. And after we cut the ribbon, please join us for refreshments, a visit with the grant program leaders, and help us to celebrate the beginning of an exciting new project at MU.
As the goodwill arm of the Chamber, we love to come out and celebrate, and especially appreciate the honor of celebrating this federal grant. Anytime we can bring federal dollars into the Columbia community, that's a plus for all of us. And I especially appreciate Chancellor Deaton's comments about that collaboration with the city of Columbia and the business community and the university. But having said all of that, let's go ahead and cut this ribbon. So if I have you guys all grab the scissors here. Congratulations